I want to go forward and talk about lung cancer, which is a very important part of the pulmonary section. And let's start off with this case here. A 65-year-old man is admitted because of headache and blurry vision over 3 days. During the examination, you notice neck vein distension and darker skin color on his face than his body. He is confused. The chest x-ray reveals a right upper lobe mass and the serum calcium is elevated. So a couple things you have to think about here that are very important. This guy comes in with a headache and blurry vision over about 3 days, and then on the examination it shows neck vein distension. The color is different. He's darker, right, in his head and his face, right, than the rest of the body. He's confused. And then you do a chest x-ray and you got a right upper lobe mass, and on top of that this patient has hypercalcemia. So right away you should think a couple of things related to this syndrome. This patient has this very interesting syndrome called superior vena cava syndrome, and we'll talk about what to do with this case a little bit later. Now the right upper lobe mass, that's where usually the masses are that cause superior vena cava obstruction. They're usually in the right upper lobe, right? That's where the area where they kind of grow and can obstruct the inferior vena cava. And then they gave you another clue as what the likely cause of the cancer is, because they told you the patient has hypercalcemia. So this is likely associated with squamous cell carcinoma, likely. And then the big question here, since he is confused, and he's got blurry vision, confusion and blurry vision and headache, right? What do you do next in this case? That's a very important question, and we're going to try to answer that with all the stuff that we talk about. So keep that in mind. So some general concepts here. So the leading cause of death from cancer right now in both men and women, this is very important to know, is lung cancer, right? So yes, the most common form of cancer in women is breast cancer, but the most common cause of death from cancer in women is lung cancer. It is much more aggressive than all the other cancers. In men, the most common form of cancer is prostate cancer, but the most common cause of death from cancer in men is lung cancer. So those are two different questions. Please understand what we're talking about. 90% of all the cases related to smoking. All lung cancers are associated with smoking. Please be careful of that. I always hear patients and students tell me, no, adenocarcinoma is not associated with smoking. That is wrong. It is associated with smoking. It is. All lung cancers are associated with smoking. It's just that in the small 10% of patients that are non-smokers, so there's something else that triggers the lung cancer in these patients, most of these cancers are adenocarcinoma. That's a different story, but all 4 types of lung cancer, all of them, are associated with smoking. When a non-smoker gets cancer, yes, it's an adenocarcinoma. Smokers have 10 times the risk of non-smokers, and that depends on the pack years they smoke, but that's about right. And they ask a great question. Well, a patient says, you know, doc, I'm going to stop smoking. When am I going to be, how many years later will I have a normal risk for getting lung cancer, right? What he's asking you is, if you stop today, how many years will it take until they have the same risk as somebody who never smoked? And the answer is never. Really, it's never. 10, 15 years later, their risk goes down to maybe about 2, 1.5, right? And then, 15 or 20 years later, it'll go down to 1.5, maybe 1.2. But those two lines always stay apart. What I really mean is that even though there is a big drop in the chance of getting lung cancer in somebody who has smoked, it never reaches the same percent as a non-smoker. So it's very important, and it's one of the reasons why smokers, when you tell them that, they say, okay, well, I don't need to stop smoking. But in reality, they go from 10 times the risk to 1.5 times the risk, or 1.2 times the risk. So there's a big drop after you stop 5-10 years tobacco. Very important. There is no screening test in lung cancer. There is none. None. Right now, we don't have one. A chest x-ray, not good enough. It's not sensitive or specific. They tried to do cytology, doesn't work. Cytology from sputum. Some people right now are looking into getting CAT scans in patients that are high risk, that have high risk, that have been smoking for a long time. They did this study in Japan, and they showed that maybe a CAT scan done in high-risk patients will catch cancer early on and give the patient a chance. Some people think that this is just a screening bias, that basically they live longer because we caught them earlier, but really when you get lung cancer, it's almost deadly all the time. So for you right now, there is no screening test for lung cancer, no appropriate lung screening test. There are 4 types of bronchogenic cancer: squamous cell and small cell, and you see the C that I put in here because they're usually centrally located, squamous and small cell. The 2 S's are centrally located. Those are the ones that are most important. Those 2, squamous cell and small cell. Squamous cell secretes a parathyroid hormone-like molecule. It grows locally, but it secretes a PTH-like molecule. This activates the osteoclast, and you get hypercalcemia. That's likely what this patient of ours has, a squamous cell cancer with hypercalcemia. Small cell cancer is deadly, very aggressive, right? Most people say non-curable disease. They tell you, yeah, it does well with chemo, but it's non-curable. And this one does all the other paraneoplastic syndromes, like Cushing syndrome, like SIADH, like Lambert-Eaton syndrome, all these endocrine-like diseases. Be aware that if you're looking at paraneoplastic syndrome and it's not hypercalcemia, think about small cell cancer. And then we have the 2 peripheral ones, large cell carcinoma and adenocarcinoma. I already told you about adenocarcinoma being common in non-smokers, but it's still related to smoking. And then a type of adenocarcinoma, bronchoalveolar carcinoma, which is very interesting. It's kind of like a low-grade cancer, but it can occur with multiple sites on the same lung or involving both lungs. Very important, because sometimes they give us an x-ray with multiple lesions on the x-ray and they say, what is this? And you think about metastatic disease, you think about other infectious causes, but you never think about primary lung cancer. And this is the type that you should think about, bronchoalveolar cancer, because they ask us, could this be cancer? And the answer is yes. It could be bronchoalveolar carcinoma. So how does a cancer, lung cancer, present? The most common symptom is cough. It's nonspecific, but that's what most patients that have lung cancer, symptomatic lung cancer, that's what they have. They always have cough. And then a combination of some other symptoms, either weight loss, a little bit of dyspnea, and maybe some